And good evening, everybody. For the second day in a row, Monroe County hit a new record high for the largest single-day increase of COVID-19 cases.
300 more cases of COVID-19 were reported today. 2 more people have died from the virus. The 7-day rolling average positivity rate for Monroe County is now 4.34%. It was less than 1% over the summer. Meantime, the 7-day rolling average of new cases per day, 227, and the total of virus-related deaths since the pandemic began is now 309 here in Monroe County. The big message from county health officials and the county executive is to mask up and take precautions. Christian Garzone joins us now with the very latest on all this. Christian, I imagine there's a lot of concern as we head into the holidays. What are they saying tonight?
There is. Dr. Michael Mendoza, the public health commissioner, says our positivity rate stands at 4.3% right now in the county, and that's only going to get higher. And we saw that with those numbers today, 300 brand new cases. Both he and the county executive said as a community, we really need to do better when it comes to things like masking up, being socially distant, and limiting gatherings. Governor Cuomo announced yesterday caps on groups getting together, limiting that at 10. He also said gyms and bars need to close by 10 p.m. The goal here, say both County Executive Bello and Dr. Mendoza, is keeping the economy and schools open, but that really starts with us, who we associate with, where we hang out, and again, putting safety guidelines in place in our own lives. Mendoza says based off contact tracing, not enough of us are doing that. Now, as we head more indoors due to the cold, Bello wants to remind everyone that is the fastest way COVID is spread. Restaurants are a big concern as well. They have new guidelines. And Thanksgiving, a big concern as well. That's when many of us will likely plan to gather in big groups. But Bello says if we get too loose with the guidelines, there could be consequences for our health and for the economy. He also says the health department and law enforcement could potentially get involved in all this.
Those will have to be investigated on a case-by-case basis. There will be investigations. There's a new enforcement strategy that is coordinated between our Department of Health and the New York State Police and the New York State Liquor Authority. So those questions or issues too that the public sees can always go to our hotline.
We all want to go back to normal. We've done it before, and I know we can do it again. But for now, we need to do better. And I know it's hard, but it's also important because we cannot safely entertain normal if our numbers continue to tell us otherwise.
Now, Mendoza says going forward, he's planning for very large numbers. He hopes he's wrong, but for the sake of public health, he is planning for the worst. In Rochester, Christian Garzone, News 8. Adam Marine, back to you in the studio.
All right, Christian, thank you. And here's a look at New York State's coronavirus numbers now. Of all the tests conducted yesterday, 2.95% were positive. Total hospitalizations are at 1,677, and there were 29 new virus-related deaths.
And as COVID-19 continues to surge around the country, a lot of people are pinning their hopes on a vaccine. On that note, pharmacies everywhere are going to play a vital role when it comes to rolling out Pfizer's COVID-19 vaccine, or any vaccine for that matter, when one is approved. And we spoke to the president of the Pharmacist Society of New York, who says Governor Cuomo's plan could be rolled out in phases.
Right now, pharmacies, from what I understand, are going to be part of the phase 2 distribution model. The phase 1 is going to be the emergency personnel, the ER personnel, the ICU people, the first responders, and the high-risk patients such as nursing homes. So pharmacists will not be involved until the second phase, which gives us some time to work out some of the kinks that we see in the first phase, which would be good.
The Pfizer vaccine is 2 shots, 3 weeks apart. The Pharmacist Society anticipates that the mass distribution will have a similar model, just like the drive-through COVID testing. And D'Angelo says if the FDA approves the Pfizer vaccine, there has to be a 90-day waiting period before pharmacies can administer the shot. The only thing that can change that is an executive order.